Court is now in session.
No.
Please, Pastor Don, would you care to listen on one prayer?
Everybody talk. Our Heavenly Father, we want to thank you for this beautiful day we have today, the sunshine. We thank you, Lord, for the opportunity to be here in this Quorum Court and to try to do the best we can for our county friends and neighbors and citizens. And we ask you to be with us and keep us seeking your wisdom in our decisions that we make today. But Lord, we want to ask you to continue to bless our military personnel that's overseas and stateside. Watch over them and comfort them and their families during the time of separation when they're serving our country. And we want to bless our leaders of the country and the leaders of this county. We pray for each one of them. We just continue to thank you for all the blessings you give us. In Jesus' name we pray. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next item is roll call. Ms. Jimmy, would you call the roll, please?
Mr. Blackburn?
Here.
Mr. Deaton?
Here.
Mr. Flake?
Here.
Mr. Graham?
Here.
Mr. Howerton?
Here.
Mr. McNeely?
Here.
Mr. Mills?
Here.
Mr. Mumma?
Here.
Mr. Reed?
Here.
Mr. Ritchie?
Here.
Mr. Swafford?
Next item of business is disposition of journal proceedings, approval of previous minutes. Does anybody have any additions or subtractions?
I'll move with approve them.
Sean moves to approve, Jack second. All in favor?
Aye.
All opposed? Next we have is public comments for 3 minutes. Do we have anyone that would like to speak? I ain't believing that.
At least they got retained today.
I think we're not doing our job right.
Next item of business is miscellaneous. We have Ms. Christy Easton from St. John's Hospital, sponsored by J.P. Flake. Ms. Christy.
Just a packet for you to take home because I'm going to go through this really quickly. First of all, I'd like to just thank you for allowing me the opportunity to be here. As a county-owned facility, I feel it's important that I give the Quorum Court an update on how the hospital is doing and just some of the things that we have going on because having a hospital in our community and in our county is a benefit. So I wanted to just give you a quick overview. We're on a fiscal year which ends June the 30th. Our hospital board of directors, Richard Harp is the chairman, and if you remember back in 1969, he actually was the chairman when we opened the doors. You can see our board members there, and they are a volunteer board that meets quarterly. Our board is local with the exception of 3 folks who are from Springfield that are appointed to come down here, but we have local control on our board. This probably is one of the most important slides that I want to show you, and this is the physician community impact that we have. You can see the number of physicians. The ones at the top all the way down to ear, nose, and throat are all physicians who live and reside in the county. The ones on the bottom are ones who are bringing those services to us locally, and so we're very proud to have as many specialists as we have, having oncology, nephrology, rheumatology, cardiology, all of those things that very few communities our size have the ability to have. So we're very pleased to be able to offer those services locally for our residents. When you look at the community annual impact, the hospital has about 142 coworkers. We've trimmed down over the last few years, trying to work smarter, and our annual payroll with benefits runs around $9.4 million annually. Our assets, which is the property, plant, and equipment, runs around $10 million. Our bad debt annually is around $4 million, which is about 11% increase over last year. System-wide, with the Mercy system, they're seeing about a 23% increase in charity care and bad debt. Charity care is around $655,000 a year. The difference between bad debt and charity care: bad debt is someone who chooses not to pay their bill or work with us at all. They just ignore a bill. Charity care, when we have patients who know they can't afford it, we have a financial counselor that will work with them, and we have a sliding scale, and the amount that we end up writing off becomes charity care. So that's the difference between bad debt and charity care. When you look at the statistics of the hospital, we had about 857 admissions. Our average length of stay for a patient out there is 3.78. Because we are a critical access hospital, that length of stay has to be under 4 days. That's one of the requirements of us being a critical access hospital. We average around 9 patients. Last time I presented to you, I think we were around 14. Having that down is just a trend in the industry. Most things now can be done on an outpatient basis, and so that's why you see daily censuses going down in small hospitals because of the technology. We see about 9,300 visits to the emergency room every year. Usually around every 1 in 5 admissions to our emergency room result in an admission to the hospital. We are seeing sicker patients now from what we used to see. I think sometimes patients wait because they don't want to have to go, and they wait until they become really sick. And so we are seeing a more sicker patient come to the emergency room. Our outpatient visits, that's 75% of our volume is all in outpatient. That's the labs and the x-rays and the radiologies and the MRIs and the CAT scans. You can see we do a lot of outpatient business there at the hospital annually. Surgeries, 1,300 is what we had for last fiscal year. Just in the revenues and expenses, we had an operating margin of 8.1% last year compared to a budget of 6.1%. When you look at our patient breakdown, we have 37% of our patients are Medicare, 10% Medicaid, 38% have some kind of insurance, and 13% have no insurance, and then we have a little sliver of folks who are workers' comp. St. John's in Springfield is our partner. They are a strong partner for us. They have 10,000 coworkers, over 600 physicians that we can have as a resource to us. They are licensed for 1,016 beds. We are licensed here for 25 because of our critical access status. The system in Springfield had a net operating margin of 5.1%, and Springfield, Mercy has been top 3 integrated health system in the nation. Their annual community benefit to all of their facilities, which is Springfield, us, Cassville, Aurora, Mountain View, and Lebanon, is about an $89 million community impact, and that's with charity care, outreach, education, research, and donations. And our amounts are included in that. One of the focus, if you're a coworker at the hospital, these 4 things are the things that we focus on continually, and that's quality, safety, service, and compliance. Under the quality piece, Joint Commission, we are accredited as a Joint Commission facility. That's the gold standard in quality hospital care. We choose to participate in that. It is a rigorous process where they go through medical records, they look at our policies, they look at our procedures, they make sure that we are providing the gold standard in quality care. We are, again, Joint Commission accredited and have been for quite some time, and I'm proud of our facility for taking that initiative in quality. Our laboratory is CAP accredited. CAP is the College of American Pathology. Very few critical access hospitals our size even want to participate in that. There's over 3,000 quality data points that you have to meet, and our lab has met those and is accredited. We also are accredited in ultrasound and vascular. As we bring in these specialty physicians, they need more and more things done to their patients. And so we're continually challenged to take our current staff and get them educated. These 3 folks in our radiology department are now vascularly trained in ultrasound and vascular, which is amazing that we have not only 1 trained, but we've got 3 at the hospital. The Arkansas Foundation for Medical Care recognized us for our quality efforts with regard to statistics. We brought them for pneumonia, heart failure, heart attack, and surgery. Again, for a hospital our size, we are very pleased to have so many quality measures. The second thing is the safety piece of the hospital. We have to prepare for disasters. We work with the county preparing for those disasters. But probably the ultimate disaster was our sister facility in Joplin. Joplin was a Mercy facility. Within 10 minutes, a facility that had 183 patients and 117 coworkers in it was totally destructed with an F5 tornado. One of the great things about being part of the system is the impact the system had on Joplin. Within minutes, because they were on an electronic health record, within minutes, Springfield and St. Louis were regenerating those charts for them because they had no way to see anything with those patients. We had assistants being deployed from all over Mercy as well as the state. Within hours, they had a triage. Within a week, they had a tent hospital. The coworkers are all on payroll, and there's 2,000 coworkers, and Mercy has kept them all on payroll. And within 3 months, Mercy made the announcement of a permanent new facility that will be built in Joplin. So again, I say that only because we have learned from what they learned from in their disaster, but to have a system like Mercy to be able to come to your aid in an event like this is just very important to this county. But as you know, it was just a gargantuan, it was a horrible disaster, and everybody pulled together. The service piece of the hospital, we are continually focusing on that patient experience. Our managers, all the way down to the frontline staff, are just evaluating our hospital as to how do we look, how do we smell when you come in there, how do we feel, are we warm and welcoming. We very much utilize the Press Ganey patient surveys to help us with that process. We always get back with patients when they have concerns, and we continually want to focus on that patient experience. We've really focused on our ER. We've decreased the amount of wait time in the ER. We've made some improvements to ER to cut down on the clutter and to make it a more professional atmosphere. And we've seen a lot of improvement in patient satisfaction when they come into the ER. The fourth leg of that stool that we've talked about, the safety, the quality, the service, this is the fourth leg, and that's the compliance. That is very on top of the agenda for our board as well as our management staff and our physicians, ensuring that we don't have any fraud and abuse out in our facility, ensuring that we follow the HIPAA guidelines and the patient privacy, and the implementation of the electronic record is going to be a great asset to us. Mercy's commitment to our community is that we are going to continue looking and pioneering a new model of care with technology. Things are different than they used to be, and we're going to continue with what we need to do to stay competitive for the future. One of the things Mercy's done is some community roundtables where we've talked with the community, asked them to share ideas, and from that we have developed 7 areas that we found were consistent throughout all of Mercy. And so these 7 areas, we have 4-state area of Mercy, which you can see we're one of the dots in the Northwest Arkansas. But from what they listened to out in the community, Mercy said these are the things that we need, and to provide those to these 4 states, it's going to cost us $4.8 billion over the next 5 to 10 years. Because there's so many need different equipment, or they need services that they're going to cost money, and so we know that we have to invest that in the 4 states that we're part of. Locally, how does that affect us? We're going to continue with partnerships with local fresh produce farmers, helping with our nutritional education in the community. You're going to see us out there being a part of the 5Ks, bike rides, swimming classes. We're going to be working hopefully with different entities throughout the county to try to provide wellness partnerships. Some of the things that we are focusing on is with children. We've done free athletic physicals to the area athletes. We've done busloads of school supplies. And we've worked with the sheriff in doing a partnership with the county on the drug collection program. Another thing that Mercy's doing that we're bringing to our local schools in Berryville, Eureka Springs, Green Forest, and Huntsville, Mercy has purchased the licensing for Health Teacher, which is an interactive online resource that teachers can actually have information about health that they can give to their students. As you know, obesity is an issue, a real issue with children, and these tools will help teachers be able to teach the kids about health education. Even a math teacher can utilize some of the modules to teach their students math while they're looking at a food label. The hospital will go to an electronic health record that's scheduled to be implemented March of 2012. That is exciting for us. Our physicians have already been on an electronic health record, so if you've been to your doctor lately, they're not using a chart. They're actually putting things into the computer. We will be up to that speed come March. In fact, we're one of the last facilities in the entire Mercy system to go electronic. The other thing now is you have access with your iPhone or with your electronic phone device to have access to My Mercy. Patients can now get their lab results, schedule appointments, renew a prescription, ask their physician a question, all from their personal handheld phone device. So we're one of the few, Mercy Systems is one of the few health systems in the nation that is already ahead on that kind of technology. Some of the things that we've done here locally, we've added a new 16-slice CT scanner, a bone density scanner is coming. We just received approval for digital mammography, which is big for the women in the county, and over $750,000 will be spent in fiscal year 11 and 12 combined to provide that needed equipment. Plus, we have an auxiliary and our foundation who also support us with foundation dollars to buy that equipment. One of the great things is, as you know, the cigarette tax started a statewide trauma program, and our hospital just received its designation as a level 3 trauma provider. What that does for us is there were some grant monies available to us where we were able to seek additional training. We were able to get additional equipment. We are networked in with the other trauma providers, and for us to be able to be a level 3 trauma, we are excited about that. And part of the criteria was you had to have a 24-hour physician staffed emergency room with surgery support 24/7, and we offer that right here in our county. So this is big for us, and we're one of the, there was an article in the Democrat Gazette that talked about it, and we're one of the few in the state our size that's already gone through the process. Uh-oh. So our master plan, when we talked about that $4.8 billion, how is that going to affect us here? We have already started an inpatient room renovation. Part of those funds were raised from our community. We've also promised the community a new physician's clinic. If you've been out to the big clinic, it needs more space, and so we will be building a new physician clinic within the next 5 years. The room renovations have begun. We are getting those up to speed, more modern, more up to date. Again, we just are going to continue. We know that the cornerstone of our hospital is having physicians here. We have a female physician joining us in Green Forest. She is Spanish speaking. She'll be here December 27th. She also speaks English and Spanish both. And then the specialists that we have coming here, we're just pleased to be able to offer that. So our mission is to bring to bring what we can locally to our local communities, and Mercy has been a great partner for us, and they've provided us with a lot of resources. And again, we are your community hospital, as you know. So any questions that I could answer for you?
Just one thing that I am not sure everybody understands. Would you explain the meaning of the critical access designation and what it does for the hospital?
Sure.
I think that's important.
So many small hospitals like us were closing their doors, and so the government stepped in with a program called Critical Access Hospital Designation that hospitals in rural areas could apply for. It didn't change anything about our hospital other than it changed the way we're reimbursed on a Medicare patient. The way that we were paid is you got a little bucket of money for whatever your diagnosis was, and we had to take care of you with that bucket of money. Well, being in a rural area, we can't always be as efficient because we've got so much overhead to have that building open and only have 9 patients in there. We can't be as efficient as a metropolitan hospital can be that has the doors full and running at full occupancy. So the government stepped in with this program that said, we're going to change the way we reimburse you we're going to give you 101% of the allowable cost that Medicare allows. We're going to give you 101% so that we can use that extra 1% to know that that's kind of our safety net to run a hospital for budgeting purposes. That's kind of what we can count on. Although Medicare only allows certain things, but at least we know with the 37.8% Medicare population, we could at least use that to help us keep our doors open. That designation helped us to the tune of about $500,000. That is what is helping keep hospitals our size open. And so that it didn't change anything about anything else other than the way that we're reimbursed. And so that's why having the critical access hospital designation has been wonderful to us. Now what we're really watching is the super committee that has to have their decision by November 23rd. President Obama has recommended to that committee that any hospital within 15 miles or less of each other any critical access hospital should close. Well, what happens is what we're afraid is going to happen is because Eureka and us are both hospitals within 15 miles of each other, we're both going to end up potentially losing our critical access hospital status. What the proposal was is for small hospitals like us that are located, like if we were closer to Harrison or closer to Springfield, what he was saying is, well, if they're that close, if they're within 15 miles of a bigger facility, then we could maybe do without that small hospital. What our concern is the fact that there's 2 hospitals within 15 miles, and right now there's nobody that can tell us, does it have to be a big hospital within 15 miles, or does it just have to be a hospital? We don't know. But if we would lose the critical access designation, it would be detrimental to us. However, we're part of a strong health system, so but if we weren't part of a strong health system, it's going to end up closing hospitals just like us back down again, which is the whole reason they put the critical access hospital program into place to begin with. So we're trying to let our legislators know, please, not only does a critical access hospital provide health services to our county, it's a great economic benefit to the counties by, helping us with recruitment and helping our communities grow. So, thank you.
Christy, what is that, what you just mentioned that President Obama has proposed, what legislative act is that in? Or?
Well, it's on the super committee that he has. They're charged with finding
$1.3 trillion.
$1.3 trillion, and if they can't come up with a solution by November 23rd that's agreed upon, it's going to go into sequestering. Is that right? Sequestration. And what would happen then is they would just take 2% off of all the programs. And
okay,
so
it's part of that
it's
penalty
part of
if they don't.
Yeah. Right.
Okay.
Christy, Gene Bland is one of your board members, mentioned this in a meeting I was in earlier this week. Isn't there a website we can go to?
There is. The Arkansas State Hospitalists, or the Arkansas Hospital Association, has what they call a voter voice, and I would be happy to get that information to you. It is with a few clicks of a button. You can actually get on there. The Hospital Association has formatted a letter that is in support of hospitals, that you can do a few clicks of a button and actually have a letter with your name on it sent to the senator. And I would be happy to get that information to you.
Try to get it to the paper and radio station.
Okay.
So we can get the word out about that.
We've been working with Randy Laverty and Brian King, and I just saw a letter yesterday that Randy Laverty sent upward to Womack's office, and the more that we can let folks know, having a hospital in communities, if you have a heart attack, you don't want to have to drive to Harrison or to Fayetteville or to Springdale or to Branson. You want to have that local intervention that can stabilize you and then get you sent on. And so, just from the health aspect of the community as well as the economic impact that a hospital has.
You mentioned that schools could access some information. How do they access that?
It's a web-based program, and we have presented and are in the process of talking with all of the schools, Green Forest, Berryville, Eureka Springs, and Huntsville. Green Forest had already been using it. through UAMS, but we've paid the licensing fee, so it's not going to cost the school anything. And that's what the superintendents were looking at, is going, so what's the cost for us to be able to have this web-based program that would cost them thousands of dollars? We said, no cost. We're going to pick it up because we know how important it is that we start with those kids at an early age. There's already obesity in children, and by the time they get to be my age and older, the demand that's going to have to the healthcare system, because they're already having high incidences of diabetes and different things that you used to never see in the kids' population. So it's very important to us from the children's aspect that we do what we can.
On the swimming part, do you teach swimming lessons? Is that what you're doing?
One of our physicians did. He partnered with the community center and taught some submersion techniques in swimming that we had several people.
I was, last year when they had those Hispanic mother and a couple kids drowned, through all the Hispanics I know around Green Forest area, I found out that most of them can't swim.
Mm-hmm.
And I was saying, I really wish you guys would, or somebody, I talked to the community center, would start and promote a Hispanic swimming lessons over here. I remember back when I was in boot camp in the Navy, I was a big old long troop of men watched bombing, almost all black, 2 or 3 Hispanics and 1 white guy. I mean, a couple hundred. I said, what was all those guys? They said, they can't swim. They can't get out of boot camp until they learn how to swim. And I asked this black friend of mine that I helped get out of the swimming pool, how come they can't swim? He said, well, white people wouldn't let us see your pools. I'm old, and that's true. But the Hispanics need to learn how to swim.
Well, we have met with the community center back just recently since this community roundtable, and we want to try to partner with them or be a resource to them any way that we can. And they've got a beautiful facility. It's a great way to promote health, and so we want to partner with them any place that it makes sense. And we have partnered with them, but we'd like to even partner more with them. So we've already been talking about ways that we can do that.
I'm glad you started the bike ride deal. I think that's getting you more popular. We'd like to have one. I like the one you have in Berryville.
We hope to continue doing those things and get behind the events that happen, and because we know that we've got to create opportunities for people to get out and get moving, and we're very much a sit down and look on your computer kind of society, and we've got to provide avenues for folks, and we understand that the wellness is going to be the key to the healthcare for the future for sure. In your packet, I've given you just a copy of the presentation. Also want to let you know, in the community roundtables, we realized that the community did not realize how far-reaching Mercy was. So one of the things that we've decided to do is we're going to brand ourselves across all of Mercy to be just Mercy. And so in the end of January, you're going to see the St. John's name drop off, and we're just going to continue with Mercy. And that way, if you're in, and this is what our new logo is going to look like, I've given you that in your packet. What that does is that gives you name recognition. If you are driving through St. Louis heading to the Arch and you don't feel well and you go into the facility there that's Mercy, when you walk into that emergency room, they'll be able to pull up your record from your doctor here locally. They'll be able to pull up any ER records that you've had. They'll be able to pull up every bit of your care, x-rays, labs, etc. And that we need to make sure people know that we are one Mercy, and that electronic health record is what's going to do that. So you're going to start seeing the St. John's name drop off. We can't make it all happen with a wave of a magic wand, but as it makes sense, we're going to begin ordering new letterhead, and the signs on the building will probably change first. We're just going to be known as Mercy Hospital Berryville. If we were located in another town, we'd be Mercy Hospital, whatever that town is. So the Berryville is the locator. The clinics will be Mercy Clinic Berryville. We have a clinic in Green Forest. It will be Mercy Clinic Green Forest. But you'll see that Mercy and that logo prominent. And then I just have given you kind of our strategic, the master plan for the community, and then just some information that I thought you might find interesting that's going on out of the hospital. So I didn't want to bore you with all of that, but I thought some of that may be of interest to you. If you ever have any questions or anything that I can answer, I'm always available. The hospital can reach me 24/7. I am always open. If you hear concerns out in the community, let me know, and we want want to address it. We want to be your community hospital, and I want folks to think about us locally. So thank you for your time. You can go over, but I appreciate your questions, and please call me if you think of other things you want to ask, okay?
Thank you, Chris.
Next item is old business. Ms. Amy, would you read that, please?
I'll move to read that by title only.
Second.
Ron moves to read the title, Mr. Ritchie, second. All in favor?
Aye.
Any opposed?
Being enacted by the Quorum Court of the County of Carroll, State of Arkansas, an ordinance to be entitled, an ordinance adopting the Carroll County Comprehensive Land Use and Management Plan Code, also known as the Carroll County Land Heritage Preservation Plan.
Move to adopt.
Second.
Mr. Ritchie moves to adopt. Who second? Mr. Dan, second. Any discussion? Call for vote.
Mr. Blackburn? Yes. Mr. Deaton?
Yes.
Mr. Flake?
Yes.
Mr. Graham?
Yes.
Mr. Howerton?
Yes.
Mr. McNeely?
Yes.
Mr. Mills?
Yes.
Mr. Mumma?
Yes.
Mr. Reed?
Yes.
Mr. Ritchie?
Yes.
If this is going to go into effect now, I'd like the permission of the judge to work with Greg and the committee to put this together to get this. It's got to be sent to all the agencies that were that will be required to call us to the table if they want to change anything in town. Has to be a registered letter going to them with a signed card come back to us. So I'd like the permission of the judge to work with Greg and Mr. Phillips and Jenna Rowe to be sure that all that is taken care of the way it needs to be to protect the county in the future.
Thank you.
Good work.
Next item being under new business. Number 8, would you read it, Ms. King?
Actually, Jason was going to read this for us, and if that's okay, and he's going to explain.
Okay.
Be enacted by the Quorum Court of the County of Carroll, State of Arkansas, an ordinance to be entitled, an ordinance recognizing the authority of fire departments to seek reimbursement for fire, safety and rescue responses of hazardous material, and environmental incidents. Whereas Arkansas law permits the recovery of costs incurred during lawful responses by fire departments for non-members and their insurance, and grants authority to the county court to establish rules and regulations for county activities. Whereas the duties of the fire departments require that they have specialized training, tools, equipment, materials, and the like to provide for the safety of the public and property when responding to calls of fire, emergency rescue, or environmental or hazardous settings. And whereas the cost of dealing with these calls is tremendous and is aggravated by responses to non-member properties. Now therefore be it ordained by the Quorum Court of the County of Carroll, State of Arkansas, Article 1. Any Carroll County Fire Company operating in its fire response area hereinafter fire department is authorized to seek reimbursement from an insured non-member for the reasonable cost of responding to calls as set out herein, as well as reasonable expenses to recoup such costs. Such reasonable costs will not exceed the fair market value of the services rendered. Section 1. For any lawful response, a fire department is authorized to recover from an insured non-member the reasonable costs of the use of personnel hours, tools, equipment, materials, mileage, and vehicles for responses to calls of emergency fire, rescue, or hazardous material or environmental incident, as well as reasonable interest on any amount that remains owing after 90 days. Notice has been given to the insurance company. Section 2. The reimbursement rates for the aforementioned costs will be set by the building fire department unless otherwise established by ordinance. Section 3. Nothing in this ordinance limits any amounts that fire department is authorized to collect under any applicable state, statute, or law. Article 2. Reasonable costs authorized under this ordinance may be recovered directly by the fire department or through a third-party billing service as an authorized agent for the collection of such costs. Section 1. If a third-party billing service is utilized, the billing service is authorized to charge an administrative fee in addition to the cost that is recovered for the fire department. administrative fee will be set by the third-party billing service. Section 2. Payment under this ordinance, if billed by the fire department directly, shall be remitted directly to the fire department by the responsible party. If a third-party billing service is utilized, payment under this ordinance shall be remitted directly to the third-party billing service, who shall then remit funds to the fire department pursuant to the contract with the fire department. All costs, except any administrative collection fee, recovered under this ordinance shall be used exclusively for the support of the fire department. Section 3. If collection costs or attorney's fees are incurred by the fire department or third-party billing service as a result of collection attempts pursuant to this ordinance, said collection costs or attorney fees may be recovered by the fire department or third-party billing service. Section 4. Unless otherwise established by ordinance, the fire department is authorized to promulgate policy with respect to the manner and method by which this ordinance is enforced. Article 3. All existing ordinances, parts of ordinances, and amendments thereof, which are inconsistent with this ordinance, are hereby repealed. If any section, paragraph, subsection, clause, or provision of this ordinance shall be declared invalid or unconstitutional by a court of competent jurisdiction, such decision shall not affect the fidelity of this ordinance as a whole or any part thereof, other than that portion specifically declared invalid.
Move to adopt.
Jack moves to adopt. Do we hear a second?
Second.
Mr. Reed, second. Any discussion?
If we, I'm sorry, if we pass this, does that, will the volunteer department or the county be liable in the case that an insurance company might say you didn't do it properly? You didn't attack this right, you didn't do this, you didn't do that. I mean, there's always that chance, is there not?
There's always that chance. The thing with that is, in the volunteer department, their members aren't paid. The fire department falls under Good Samaritan Act. The members fall under Good Samaritan Act. They're going to have to prove that they violated the Good Samaritan Act by gross negligence, things of that nature. With any training, the training certificates and everything of the firefighters should cover that. It wouldn't be easy for them to do. Like I said, there's always that possibility, but I kind of know. Devin, do you see any problem?
I don't see any increase in liability based on this. It'd be the same liability that they face now.
Ron?
Jack?
As long as the firefighters work within their scope of practice, in other words, if they go out there and try to do something they're not trained to do and don't do normally, then yes, they could be liable. As long as they work within their scope of practice and what they've been trained to do, there shouldn't be a problem at all.
Ron?
I look at it from a whole different angle. It's not, this isn't the firefighters doing their job. This is allowing a fire department, which is made up of appointed and volunteer people, to basically hire a collection agency to go out and collect money that is really county money. The county's responsible for the fire departments. We fund anything they need above what they get in grants. And I think what we're doing is abdicating a big portion of the Quorum Court responsibility to some third-party collection agency or attorney. We're letting them charge fees. We're letting them collect fees for county services. I think I don't have a problem with trying to find a way to collect for our emergency services, and I think a lot of places do that. I don't think this is the right approach to it. I think that it needs, any monies obviously need to be collected by and handled through the county treasury, not through the fire departments. If we're out suing people in the county's name, which is what we'd be doing, that money needs to be accounted for and audited with all the other county funds. I would like to see us find a way to get some money back. I don't have a problem with that. I do have a problem with trying to do it this way. I would rather have our attorney look into ways we can try to collect money from, especially from negligence-caused fires, people intentionally causing fires. There should be some way that we can recover some of our expenses, some of the fire department's expenses, and certainly the money should go to them. But I hate to see us turn it over to an independent attorney or some collection agency to try to collect money this way. I think it should be handled through the county, and then if we get a procedure going to collect the money, and we like it, and we find somebody who we can work with, and we have some control in the fees and expenses they charge, this gives them an open door to charge whatever they want for doing the service.
What fire departments does this pertain to?
There's 9 fire departments in the county. It pertains to all 9 of them.
Including the city fire departments?
Right. Because we've changed this 2 or 3 times trying to get the wording right, because even though like Eureka Springs is a city fire department, they've also got a rural fire department. Holiday Island has not a city, but a community fire department. They also have a rural fire department. And then all the other areas, and like I said, the cost, I just spent $4,500 the other day for one tool to cut into new cars. Chief Williams back there just spent over $30,000 to update his system to get into the new cars. Right now, the state allows us, if we have a fire in a rural area or anywhere else that's not covered by membership, the state allows us now to go bill those folks, and the money comes straight to the fire department. Right now, there's 9 fire departments, and it's being done 9 different ways. This is kind of a way to uniform it. Yes, there is a third party, and the reason we had to do some more work because there was an attorney that was trying to get involved in it. But we're using a third party, that's their business, and they provide the forms and shows us what the state allows us to charge for different things on the sentence. It's just trying to help the fire department recover. Because a lot of times there's a wreck out there on 62 especially that ties up 2 or 3 hours in the middle of the night with equipment and supplies, and they just, the people are from Chicago or someplace else, they're spending a little money as a tourist in this area, but it's not coming back to that fire department, and then nobody gets reimbursed.
And our sheriff runs up expenses on those. I think I don't have a problem with trying to work this out. I'm just concerned mainly about having the fire departments handle it directly. I think it should be handled through some other part of the county, or if we're going to have a private collector, then we need to have some more specific rules for the private collector, and the money, I think, needs to go through the county treasury, not through the fire departments. I think that's too risky. Jason's trying to say something.
Right now, Ron, and to get back to your question, going through the county, the only thing the county gives the fire departments right now is the county judge, again, is supposed to give them $1,000 a year.
Mm-hmm.
Okay. They can apply for Act 833 funds, which is the insurance turnback funds. Most of them do, which we're proud to see because there's a lot of carryover from different parts of the state. What this does, that money that they get in doesn't support the fire department. It may let them buy a 100-foot section of hose. It may let them buy a nozzle. That's about it. What this will allow, talking to some of the other fire departments to do this, Inspiration Point Fire Department already in the county already does this. The billing company that they use and the state would like to see a Quorum Court approval of it because there was some conflicting state laws, and this sets that aside. And there's numerous billing companies out there. There's a billing company out there, the one that I know of being used right now. They don't charge the administrative fee anything. They said basically the minimum on their bill that the fire department gets is $1,000. They may charge $75 administrative fee, and that's collected from the insurance company. We're not talking about suing individual uninsured people. With this, the way this is outlined, it's basically collecting from insurance companies. Most insurance companies have a built-in response fee, but sometimes they like to say, well, no, we don't really want to pay it. Recently on I-40 in Franklin County, where Ozark's located, they spent 22 hours on the side of the highway with a J.B. Hunt truck. They billed J.B. Hunt through that billing company and reimbursed $7,000 from that. And it's basically from the insurance companies that have that built-in response charge in there. They're not going after any single person. If you're uninsured and something happens, they're not going to go and try to take your property.
Well, this doesn't say that. This says you, and to go after the insurance company, you go through the insured individual. You don't, you are bringing a party, an individual into it to collect from the insurance company, and I'm just concerned. I think we need to find a way to collect reimbursement. I'm all for that, but I'm just concerned about the way this is worded and all the leeway and leverage it gives to that collection agency.
Is there anything in state law which prohibits a fire department from doing these very things right now?
There are actually state laws allowing for these things. There's some concern about whether they're conflicting. I don't really think they are. Maybe in the personal property section, there's a difference between 500 and 800. But the two phrases they use are reasonable cost and fair market value. And so what I did here is just harmonize those two and said you can get reasonable cost, but no more than fair market value. But the state law is already in place,
So why are we doing this?
and that's actually what I asked Jason, and the reason that we got is because some view those state laws as somewhat inconsistent, but, and you can explain this better than I can, someone wanted it for
Yeah,
procedure.
a couple of the chiefs and said, you know, that have been looking at state law, stuff like that, said, you know, and they called down to the fire services coordination down Little Rock, and they said it's always better that if you have a Quorum Court ordinance supporting this, because in that way it says that and it takes out all the confliction of the state laws. They said it would be in your best interest to do that. And another thing, you're talking about reasonable cost. There's an ordinance that we're planning, or a resolution that if this passes, bring back outlining the cost. It has specifically item by item amount that they can charge. It won't be they just charge, okay, I want to charge this company $10,000, I want to charge this company $5,000. No, it's set, a set rate. And they break that rate down into, you know, hourly rate for a standard firefighter, or if you're a captain, lieutenant, assistant chief, it breaks it up.
Does it include collecting for the deputy sheriff's work out there and the CERT response teams and all of those things?
No, this just says for fire departments.
So we can't, if we decide to sue to collect for fire department services, we can't include in that collecting for the sheriff's 3 deputies that are out there working and.
I'm not sure if it has that rate on there or not.
If we're going to do this, it seems to me, and for the money, you're talking about the fees are all set out in this other, you said resolution, it needs to be an ordinance to be effective, but that should all be part of the same ordinance.
John?
Ron, you keep jumping back and forth between the sheriff and the fire departments. You know, what the sheriff deals with, it's not insurance. These sort things and some of the sheriff's business, it's not insurance. The way I understand Jason, that he's just after the insurance. Is that the way it's written, Devin, that we are just collecting from insurance?
The way it's written is you're going after insured non-members.
That's the only people, insured.
Right, insured.
No one else.
Now,
So,
could I,
yes,
one more
please.
thing? There's a distinction here because between the sheriff, the laws that this is based on are specific to fire departments. They don't cover the sheriff.
So what I was getting at, part of your concerns aren't really valid, in my opinion, dealing with this particular ordinance.
Well,
John, you got something you want to say?
Well, I was just wondering if having the Quorum Court responsible for setting the finding the collection agency and setting the rules, would that correct your concerns?
no, I think that if the Quorum Court's going to pass an ordinance, we ought to put in this ordinance that we can also collect for the sheriff's time, for the other county, the times that are involved.
People aren't insured for things like that, though.
Well, if they're insured for the damages they cause in an accident, they are insured for all the costs that the county incurs. You can go to collect that.
Question for Devin. The statute, does that refer to collecting, that the fire department has the power to collect irrespective of whether or not a person is insured? What I'm asking is, so the word insured does not appear in the statute.
Right.
Okay, if we pass this and say we're only going to go after those who are insured, does somebody who has insurance have a claim of discrimination that we're only picking on them because they chose to buy insurance?
I don't really think so because there's state law that reflects either one. So
Okay.
it's just a question of what particular provision you're going under.
Okay. I just don't know why we're doing this if it's already provided by state law.
Perspective is always useful in these kinds of discussions, and by that I mean we can't be the first county to come up with this idea, so who else is doing it? Obviously other counties are. And we used other examples from around the state to craft this particular draft word.
Jason presented something And I took it and looked at the statutes and reorganized it and changed the wording up so that I thought it matched.
Right, the ones
and
we
made
got.
more sense.
Right. The ones we got currently, Franklin County, Perry County, Pulaski County, Sebastian County, Clark County, Hot Springs County, all use this certain things. And the majority of them in the central part of the state for some reason.
One of the things, to answer your question, because I did not agree with this to start with, I don't agree with the state does it. Do you live in the Eureka Rural, right?
Yes, and I'm a member.
And you're a member. So if you have a wreck out there, I don't think you should be charged, or your insurance
Yeah, you're
should
not
be
going
charged,
to.
because you're already paying a membership fee. The way the state is set up, they would bill you. Now, the way I propose doing this, you would not get billed, because you're already paying the membership that covers this. It's the same way on the structure fire. If we have a member who pays your dues every year for a structure fire, I don't care how many fire trucks I take out there, they don't get billed anything. But now, if they chose not to be a member, then I'm gonna charge them heavy, because there's a lot of stuff. The way the state, if I'm wrong, they'll let me know, the way the state is set up, it has no statutes or no wording at all discriminating between a person that's a member of that district fire department or whether or not. Is that?
Actually, the statutes I were looking at did say non-members.
So members are protected under the state statute.
Yes.
Well, the collection provisions are limited to non-members.
Members are protected under being a member.
John?
Well, just one more question. You're comfortable with this, Devin, as it is written?
Now, John?
Oh, I'm just saying that to Ron's question, the member is protected because being a member, you don't get charged for.
Well, but if the state law doesn't provide that, and we're going under the state law, then it could be a problem. It's a conflict, and that needs to be cleared up. But I agree. If you're a member, your agreement with that fire department covers it. But if you're not, if non-member fire departments, if a fire department you're not a member of responds, they could conceivably sue you.
No.
No, we have a mutual aid contract.
We do?
Yes, each fire department has a countywide mutual aid contract, and that's lined out in there.
Okay, so only the primary fire department can go to
Right,
collect the
that's what it
costs.
says right here in your primary response area.
What about if you live in a city and you're being in a city, you have to pay taxes for it?
The city, no, this is talking about
Same as
rural fire department, stuff like that. Now, like say, Jack's community fire department, they may roll out and assist. They're all the same members, I mean, the same personnel. But it's broken down into two different fire departments, just like Three Springs has two different fire departments. But everybody assists each other. That's going to be under that mutual aid contract.
Are the fire departments losing money or something at this time?
The funding for fire departments is getting tight. There are a lot of fire departments that don't meet the state minimum of 5 certified firefighters. We almost had that happen in Carroll County, and the community in Carroll County came together as a whole and got them back up and running. But there's fire departments that are going defunct in the state because of lack of funding.
Are you filing insurance claims already and they're just not paying?
No. A lot of them are. Inspiration Point's the only one I know of that is right now.
One of the big problems is just the cars in the last few years. It's changed so much that none of the fire departments had equipment to even cut a door off. And that's very expensive. And there's departments out there that does not have the equipment, and they've got to recoup those expenses and try to get this equipment. Because you've got a person trapped in this car and they sit there and shield the thing, they can't cut it open because of the new metals. It looks bad for that part. You've got to wait till the one that has it to get in there and assist us. That's why we're trying to help them any way we can.
Jason, do you know why other fire departments in the county aren't doing the same thing Inspiration?
Because Inspiration Point, when we started talking about this, we've known about this for approximately about 6 months now. It was brought out at a convention. Then I brought it back to the fire chiefs meeting and presented to them. Nobody knew about it, including myself. Had no idea about it. Brought it back to them. And they're all like, "Oh, wow!" Inspiration Point just jumped on the ball right then and just started building. The other ones haven't yet. They were waiting on this to go through because they want to make sure that everything's good to go, and then they're going to start.
So they can start without this. They can start under state law.
They can, if, any way they want to do it, if they want to self-bill, whether they want to go through a third-party billing service, whatever. I know Inspiration Point's going to the third-party billing service right now, and they've got everything on hold until something is passed, they're not billing. That's why the 90-day retro.
I just think it's redundant to adopt an ordinance that's already provided by state law. And maybe the departments didn't know about it, but they know about it now, so they can move forward with either billing directly or through a third-party agent, irrespective of what we do.
Right, but if they, one thing on that, if they do that and they go outside state law, whether you're a member or not, or whether it's you're uninsured or not, they're going away. We're trying to make it more stringent on who they can do. We don't
They can only sue who state law permits. We can't change that.
Right, you can't change the state law.
So they can only go as far as state law allows, regardless of what we say. They are limited by state law. The words in state law tell them who they're able to go after and how they can do it.
Right.
Correct?
Any more discussion? Call for vote.
Mr. Blackburn?
Yes.
Mr. Deaton?
Yes.
Mr. Flake?
No.
Mr. Graham?
Yes.
Mr. Howerton?
Yes.
Mr. McNeely?
No.
Mr. Mills?
No.
Mr. Mumo?
Yes.
Mr. Reed?
Yes.
Mr. Ritchie?
No.
That's our first reading.
Next item on the new business is B. You read that, Ms. Jim, please.
Be it enacted by the Quorum Court of the County of Carroll, State of Arkansas, an ordinance to be entitled, an ordinance transferring FEMA monies received to Fund 42 Road and Bridge Disaster, line item 04, contract labor. Whereas Carroll County has received $50,321.64 in reimbursement from FEMA for storm cleanup. Now therefore be it enacted by the Quorum Court of Carroll County, State of Arkansas, the sum of $50,321.64 is hereby transferred from County General to Fund 42 Road and Bridge Disaster, line item 04, contract labor.
Move that we approve.
Mr. Graham moves to
Second.
approve. Joe had his hand up. Mr. Mills second. Any discussion?